As the Kampala local maternity and neonatal systems, we join the rest of the country in the 10-day activism to increase awareness about preeclampsia or hypertension in pregnancy. One of the reasons we are doing this is our mortality, maternal mortality and neonatal mortality is still high. Worldwide, we have 2/3 of maternal deaths being in sub-Saharan Africa. And in Uganda specifically, our maternal mortality rate is around 189 deaths per 100,000 live births. We've had a reduction, but that is still quite high. It is the leading cause of maternal mortality, and that is preeclampsia or hypertension in pregnancy. Preeclampsia does not affect the mother alone. It also affects the baby. We have over 70% of morbidities that we have in babies being attributable to preeclampsia or hypertension in pregnancy. And currently, our neonatal mortality rate in the country is around 22 per 1,000 live births. That is still quite high. So the burden of preeclampsia or hypertension in pregnancy is very high. Those who survive, some of them survive with complications, and these take a big toll on the economy of the country. For example, if a mother gets preeclampsia, they are likely to get issues with their kidneys, they'll get issues with their liver, they might get issues with their brains because of the effect of preeclampsia. And this can lead them to going into ICU. Now, the cost of managing a patient in ICU is very high. Now, on top of that, we are likely to have a preterm baby. A preterm baby who needs an ICU, neonatal ICU, is also going to be a very big cost. So preeclampsia does not just affect the mother, does not just affect the baby, but affects the country as a whole. Through our MPDSR and improvement activities, we realize that there are deaths that are attributable to the fact that there's poor governance or leadership, there's poor accountability among the health workers, and poor referral systems. So that local maternity and neonatal systems, which are around the country, even in other regions, they help to bridge this gap. Kawempe National Referral Hospital is the hub for the Kampala local maternity and neonatal systems. So KLMNS involves districts around Kampala: Mukono, Wakiso, Mpigi, and Kampala Central Business. And because we receive referrals from these facilities, so Kawempe National Referral becomes the hub. Now, the local maternity systems were created by the Ministry of Health as a way to curb maternal deaths and neonatal deaths.